Yeah, that would be great.
Okay. You are going to have, suturing and knot tying. And what that consists of, you're going to perform a suture or closure of a superficial wound. What that entails and what the proctor is grading you on will be that you hold the instruments correctly. Now, how do you know that? Dr. Trinidad he showed you the first day, right? The orientation.
Mm-hmm.
So you know how to hold them correctly. You will be graded on that. You perform a simple interrupted suture, and there should be 6 ties to that. 6 knots. I'm sorry, 6 knots.
And
One
tied
suture, 6 knots.
times.
Yes.
Okay.
Yes.
Okay.
Just one suture?
Yes.
Just
Yes.
one knot?
Yes. 6 knots. Okay.
Well, if you can do one.
And then now, what you're gonna do, you're gonna have some kind of arm or something like that to do that too. But then you're also gonna have that ethicon board at the same place, in the same station. Okay? It's going to be in the same station. So you're going to have an arm to suture, and then you're going to have the ethicon board to tie the knot.
Can we just
How many sutures are you putting in the arm?
One suture, 6
Yes,
knots.
6 knots. Right.
Instrument time. Instrument time.
Instrument tie.
Those are instrument ties. Right. Then you asked Dr. Turner.
Oh, I forgot.
I mean, 6 and 6 minutes.
Okay, but
and
that's what we've been doing.
ethical
Okay.
for
Breast
surgeon,
examination, which
for noobs like us.
Beverly just showed you earlier. You're going to talk it through. Remember to do that. Talk it through. Okay, the female catheterization. That's what we just did. Okay. The mammogram, it would be of probably a left breast mammogram. Okay, and you're going to be trying to identify whether you know it's going to be benign. Probably, you're going to tell what you see. Okay. Patient history and physical. You're going to have a standardized patient, and these are 2 separate stations. The standardized patient will be there. Please don't be pressed on them, harshly, because that's a complaint. There's been a complaint. Just be easy. And because remember, there are 30 of you.
That's 6 minutes?
We do have, that's 6 minutes.
For history and
For the physical?
There's 6 for
minutes
each.
for the history?
Yes.
Are they connected?
You're not in the same room.
No, but this is the same patient.
No.
Okay,
It'll
so
be 2 different
No,
patients.
you have 6 minutes to do a complete physical or a focus?
No, just, it's an abdominal pain.
Oh, okay.
So,
Also an abdominal physical?
like, yes, right here.
Okay.
That's it. Make sure, the history, when you
Abdominal
sit
pain.
down and talk about, what it might be, differential diagnosis of, it could be, gallbladder problems or just chest pain, that kind of thing. You're going to ask them questions about that pain. How you would ask.
It's not going to write up though, right?
Excuse me? Yeah, that's going to
You
go.
want us to talk to them about the
Yes.
Physical, not related.
Yes, just talk. When did you experience this first? When was the first time you experienced
Okay,
it?
so just like a focus
Yes.
history on that problem and then just do that abdominal exam.
Exactly, but the abdominal exam is another station, in another room.
Wait. So one room is just
Oh,
history.
just
One is, that's what I'm saying, it's 2 different
I
stations.
thought you said 2 different cases.
No, 2 different stations.
Okay.
One is history, the other one is exam.
We got it.
Okay, got you.
That makes it easy.
Okay, remember, every time you walk in a room, first thing you're gonna knock on the door, introduce yourself, and talk loud enough so we can hear you. Like, we have to sometimes listen to you on the audio, computer, so make sure you talk loud enough so if we need to go back, if there's a problem, you say, I did ask that question, I did say this, and then we can hear it, Okay? You're gonna, see, abdominal diagnosis, breast conditions. There's gonna be some case scenarios, okay? So it'll probably be about 2 cases that you'll have to determine what the differential diagnosis is and treatment plan.
Is this paper?
Yeah, that's the paper.
Also, 2
Yes.
stations of paper.
Paper. And the IV intravenous technique. So you need to know the steps in order that, and the only way you're gonna know the steps is.
So it's 8.
It's 8. Yeah. say different stations. Now, we usually have a rest station where we probably won't in this case.
You said we have to talk through the IV steps?
Yes.
You have them?
This is what I need to, hold on, let me get the IV. Okay, this is what the faculty who's grading you is gonna be looking for, okay? You're gonna apply the tourniquet approximately. You know how to do that. It's just easier to, once you see the demonstration on how to, where these are placed. Okay, you're gonna locate the vein and that kind of, you're gonna know how to do all these steps. Okay, make sure you do this. Hold vein in place, okay, before you puncture it, okay? With the needle. Puncture the skin with the bevel needle upward. Make sure it's going upward, the bevel needle, okay? Notice the blood return and advance the catheter. Well, you're not gonna see that on this arm because you're not gonna be able to see any blood in our tail where it's coming out. And then you're gonna withdraw and remove the needle and attach the saline lock. Okay, and then remove the tourniquet at that point. You would, no, the needle is the regular.
Yeah.
I got one right here.
Do we have to?
It's almost like a spring action.
There's like a little spring to it?
Yeah.
Okay,
They've been using those lately.
here it is right here, and then I've got the little lock. I think I've got it in.
We don't have to prime like the fluids.
It's in the little packet.
It's right here. It's like a little,
It's right there.
We probably just.
Yeah. He
I
did
know.
use access.
anyway, yeah, all that's in there. And make sure, okay, first of all, you're going to go through all the steps. And I've got to tell the faculty who's grading you, they need to see you go through the whole step, because if you don't go through the whole steps, you may forget how to do it. Don't you think so?
What do you?
So when I say the steps, each step to the IV, to insert in the IV. In the past, we've done this, where you just, you're saying, I need to do this next, you're talking it through, but you're not actually inserting the needle. I think you should insert the needle in order for you not to forget the next step.
So what are we inserting the needle into?
Into an arm. It's a model. Arm. You can't see anything. You can't see any return, nothing. Right.
Is there a certain aspect of the arm I'm supposed to go into?
That's the vein. It would be like a little vein you can see.
Oh,
You can see the vein.
You can see it.
But it's not going to move or anything like that. Yeah, the markers. Yeah.
Yeah, when we come to practice, are y'all gonna have needles for all of us to stick the thing?
Yeah, so that's the thing. That's what we're going to have. You can use the same, well, they
Just have one.
can use the same needle because it's just a demonstration.
But if it's the spring thing, you can't.
You won't be able to do it.
Yeah. So I don't know what they use.
It's right here. This is what you're talking about as far as
Yeah.
this little part.
Safety laws, the plastic model.
It's already attached. You can take it off. We can reuse this.
Is this what I'm gonna do?
That's the part that comes off. You have to. You But when they come, the nurse comes and does it, then she'll have it.
Like, man, let me just kind of get the high rates.
I have to get it.
So wait, what did you?
When he came up, he told me,
Okay, so just look out.